Patient's going to be in short sitting. Examiner is going to be on the affected side. We're going to be assessing if the patient needs imaging on the elbow. And with this test, it's the elbow extension test. If they can't do it, then they need imaging. To assess the medial collateral ligament of the elbow, we're going to be doing the MCL stress test. We're going to have the patient in short sitting. Clinician's going to be on the tested side. This test can be done at 0, 20 to 30 degrees, and also dynamically. We're going to have the patient extend their elbow to 0 degrees, and then our fingers will be palpating the medial collateral ligament between the medial epicondyle, a little bit distally to that, and we're going to be applying valgus force this way towards the elbow. And if there's any pain or laxity compared bilaterally, it's a positive sign. We can also do it at 20 and 30 degrees and also dynamically. For this one is a little different. We're gonna use our body as a fulcrum, and we're gonna be palpating with our thumb for the MCL, and then we're gonna bring it out. And if you notice any pain, the same signs, then it's positive sign for MCL sprain. We're going to be assessing for an LCL sprain with an LCL stress test. Position of the patient is short sitting. Patient have their elbow flexed at 30 degrees. Examiner is going to be on the affected side. Distal hand is going to be a distal radial ulnar. Proximal hand is going to be feeling for the lateral, distal to the lateral epicondyle. We're going to be feeling for gapping or any pain relative to the other side. And if there is, then there may be an LCL sprain. We're going to be assessing if the ulnar nerve is being compressed around the elbow with the Tinel Sign. The patient is going to be in short sitting. Examiner is going to be on the affected side. Patient is going to have their elbow flexed to 30 degrees. The examiner will tap on the ulnar nerve in the groove between the olecranon process and the medial epicondyle. If there is neurological signs or symptoms, then there may be compression of the ulnar nerve. We're going to be assessing the lateral epicondylitis with the Teres elbow test, or also known as the Cosen's test. The patient's going to be in short sitting. Examiner is going to be on the tested side. Bring their elbow up to 90 degrees of elbow flexion. Ask them to extend their wrist. If there's any pain at the lateral epicondyle, that will be a positive sign. If you ask them to do it again while palpating and ask them to resist the motion, if there's any pain again, then it's a positive sign. And this time have them relax. We're going to be extending, relax. We're going to be extending the muscle belly of the extensors. If there's any pain, it's also a positive sign for lateral epicondylitis. We're going to be assessing the medial epicondylitis with the Little Leaguer's or golfer's elbow test. The position of the patient is in short sitting. The examiner is on the tested side. The examiner cups the patient's elbow, which is flexed at 90 degrees. We're going to ask the patient to flex their wrist. If there's any pain at the medial epicondyle, then it's a positive sign. Resist the motion while we pull it into extension. If there's any pain, it's also a positive sign. If we stretch the muscle bellies of the wrist flexors, if it reproduces any pain, then it's also a positive sign for medial epicondylitis. To check if there's median nerve entrapment, we're going to be doing the Pronator Teres syndrome test. The patient's going to be in short sitting. The examiner is going to be on the tested side. Elbow is flexed to 90 degrees with hand supinated. The patient is instructed to pronate the hand while I passively bring the elbow into extension. So I'm resisting the motion. And if there is any pain, then there may be a compression of the median nerve as it passes under the Pronator Teres muscle belly. To check if the ulnar nerve is being compressed under the cubital tunnel, we're going to be doing the elbow flexion test or the cubital tunnel syndrome test. The patient is going to be in short sitting. Examiner is going to be on the tested side. Patient will actively flex and extend their elbow for 5 minutes. They can do it pretty quickly. And if there's paresthesia in the ulnar nerve or to the distribution is over the forearm and the hand, then it's positive for compression of the ulnar nerve in the cubital tunnel. To check if there's compression of the posterior interosseous nerve, we can do the Supinator syndrome test or the radial tunnel syndrome test. The patient's going to be in short sitting. The examiner is going to be on the tested side. Elbow is going to be flexed to 90 degrees. We assess the grip strength of the patient. Yep, bilaterally as well. Go ahead, grip it. Yeah, and we're going to be asking the patient to grab my forearm, ask them to supinate, bring their palm up while I resist. We're going to do this 10 times. Okay. All right, he looks a little weak, yeah. And we're gonna assess grip strength again. Yeah, clearly weaker. And if there is muscle weakness of the forearm extensors and or wrist extension, this may indicate that there's compression of the posterior interosseous nerve. To check if there is entrapment of the anterior interosseous nerve, we can do the Pronator syndrome test or the pinch grip test, also known as the OTE test. Okay, the patient's going to be in short sitting, examiner is going to be on the tested side. If they're able to do this, it's a negative sign, but if this occurs, then that is a positive sign for anterior interosseous nerve entrapment.